All right. Hi, everybody. This is Corey Wilford. I'm the communications manager at the Larimer County Department of Health and Environment. We are going to talk today a little bit about staying healthy this fall and winter. You've probably heard that COVID-19 is on the uptick, and then we'll also be seeing influenza or the flu and RSV this season. So as we know, these viruses are seasonal. They usually uptick in the fall and winter. And so I have a couple of folks here from the health department to help talk about some of the vaccines and just kind of what we're seeing across the board with these viruses. So first we have Erica Cathy. She's our communicable disease and emergency response and preparedness manager here at the health department. She's going to talk a little bit about what we're seeing with COVID-19. And then we have Haley Byington, who is our immunization services supervisor down in our clinic. And so again, we are trying to promote that everyone stays healthy this fall and winter. So we'll be sending out some news releases. We have some social media stuff going out that we would love for you as community members to share out, talk with your friends and families about the importance of getting vaccinated for these respiratory viruses, and also practicing all of those things we learned during COVID, including, good hand washing, staying home when you're sick, testing for COVID to know if you have it and to stay home if you have it. And so we're excited about kicking this off and spreading the word. So I'm going to turn it over to Erica Cathy, who will give us kind of an overview of just where we are at with COVID-19 so far this season.
Thank you, Corey. So currently our situation is that the overall burden of COVID-19 remains low compared to previous seasons. And we rely heavily now on wastewater and other metrics with the increase of at-home testing and not receiving reports of positive tests. Those are the metrics we use to determine what the levels of COVID are in our community, along with hospital admissions, which are increasing, but coming up from very low levels from this past summer. We are keeping a close eye on that. To give you an idea of how our hospital admissions compare to previous years, right now, we're at about 2.5 hospital admissions per 100,000 residents. And we did see an uptick from about 1.7 to 3.9 between the months of August and September. Back during the previous COVID waves, such as Delta wave, we were seeing 20 residents per 100,000 or 25. So we're still seeing pretty low numbers as far as hospital admissions. And then less than 1% of our inpatient beds in Larimer County at our hospitals are occupied by COVID-19 patients. Again, compared to the Delta wave and Omicron wave, when we were seeing upwards of 15% of our inpatient beds occupied by COVID patients, we're still seeing those pretty low levels in our hospitals right now. And I have a graph on the next slide that'll show you a little bit about that comparison. So we do expect to see a little bump. As you can see clearly the Alpha wave in 2020, Omicron and Delta following that, the large waves, and then where we are today as far as our patients hospitalized for COVID. So still fairly low. Again, we expect to see an uptick with, as Corey mentioned, COVID becoming one of our seasonal respiratory diseases. That would not be a surprise, but we are monitoring our hospitalizations carefully. And on the next slide, I have a comparison showing these are emergency room visits for COVID-19, influenza, and RSV. And you can see that we're approaching a level similar to what we saw in January during the winter with COVID. So we are seeing a pretty big uptick in COVID, not so much RSV and flu right now. According to CDC modeling, we are expecting to see a fairly normal flu season this year, a pretty moderate COVID season, and then an RSV season. We're not quite sure, but there have been improvements in disease reporting around RSV, making them a required disease that's reported, so we can track that a little closer. As far as worst case scenarios, what we're planning for is, a triple-demic, as they call it. So all three of these respiratory viruses peaking at the same time. That would definitely put a strain on our hospitals. Of course, the new COVID variant is always a concern that we're monitoring for as well. But the message that we're sharing with hospitals is that influenza and RSV every year stress and strain our hospital systems. The addition of COVID, just adding a third virus, is going to increase that. So we're working closely with our hospitals to get prepared for that. And I believe I will turn it back over to Corey.
Thanks, Erica. So when, I've been hearing a lot of folks just saying like everyone is getting COVID again. Everyone seems to know someone who's gotten infected in the last couple of weeks. But you're saying that even though we are seeing this little bit of an uptick, it's still really low and lower than it's been throughout the pandemic.
Exactly. Yes, we are expecting it to even go up from here as far as the infections, and that's going to be with COVID being endemic now. That's something we're probably going to see every season. We anticipate. It's just making sure that our hospitals don't get completely overwhelmed by a new variant or that triple demic.
Great. Thanks, Erica. All right, I'm going to turn it over to Haley Byington to talk a little bit about the new updated COVID vaccine or booster. And she'll talk a little bit about that, who should get it, when and where it's available. And then also she'll hit on a little bit of flu shots this year and the new RSV vaccines as well. So I will turn it over to you, Haley.
Yeah, so the new 23-24 COVID-19 vaccines have been updated to provide protection from the current circulating COVID-19 strain. So everyone 6 months and older is recommended to receive an updated 2022-2023 COVID-19 vaccine, at least 2 months after getting your last dose. The COVID-19 vaccines have now become privatized, so different from previously. And those who have public or private health insurance should be fully covered to receive the vaccines. The health department is no longer able to provide the vaccines free to everyone. People that meet certain criteria can get the vaccine at little to no cost from gap filling and safety net locations, including the health department. And the people that would qualify would be children 18 years of age and younger who either have Medicaid, who are uninsured or underinsured, for Alaskan Native or American Indian, adults 19 years of age and older who have Medicaid, who are uninsured or underinsured. And there will be limited quantities specifically for the adults 19 years of age and older who meet these requirements. Some of the information to give a little bit more background on what underinsured means is that you have health insurance, but it might not cover vaccines, or it doesn't cover certain vaccines, or it only covers vaccines to a specific coverage amount. So those would be some important things to look at with your insurance coverage. We do also have private pay or out-of-pocket payment options as well. And there will be a lot of different providers available in our area throughout the county that will be providing COVID-19 vaccines. Those will be available through specific pharmacies and through some private physician clinics. And then flu vaccines are readily available and they're recommended for everyone 6 months of age and older. The health department is able to provide flu vaccines to people under the same criteria as COVID-19. And the flu vaccine is available right now at most pharmacies and some private physician offices. And then touching base on the RSV vaccine, which is new and exciting, is that there is an RSV vaccine available for those 60 years of age and older, and you want to call your primary care physician or local pharmacy for availability. It's not something that we're able to provide here at the county. There will also be a treatment available to help prevent RSV in infants and children that are entering their first RSV season, and this will soon hopefully be available as well. The county will be able to provide this through the Vaccines for Children program, with the above criteria that we discussed applicable as well.
Awesome. Thanks, Haley. So to kind of clarify, especially with the COVID vaccine at the health department, we used to be able to provide it at no cost and people could go out to the ranch and get it, for no cost and just drive through. But now people can get it through their employer-sponsored healthcare or their private healthcare insurance, but not at the health department unless they are uninsured, underinsured, or have Medicaid, essentially. Is that right?
That is correct. Yes.
Okay, so, and then it seems like most pharmacies have it, and many doctors' offices also have the new COVID vaccine at this time.
We are seeing that starting to trickle in. We've heard from a lot of different community members that have been able to receive this at pharmacies. We've heard specifically with King Soopers and Walgreens that they're able to, and then it is beginning to trickle into other smaller pharmacies and some physician offices.
Great. And then is it okay to get a flu shot and a COVID shot at the same time, or should you do those separately?
It is absolutely okay and even recommended to get those at the same time.
Good. Okay. So folks can kind of find a place to get it, request both of them, and then be good to go and help reduce that risk of severe illness and hospitalization and death. Okay, so that covers the COVID vaccine. What if someone has never gotten any COVID vaccines in the past, or they just got a booster more recently, like in the last few months? Should they still get this one, or what's kind of the criteria for getting this new updated booster?
Yeah, that is a good question. Most people who have not been vaccinated at all for COVID-19, children from 6 months to 4 years of age, will likely need more than one dose. Everyone else ages 5 and up will be indicated most likely for just one dose at this time. So really important to work with your healthcare provider and discuss that with them specifically.
Awesome. And then Erica, I think we were looking at some numbers about who has already gotten it or how many Larimer County residents have gotten it. Do you remember that number?
Yeah, it was close to 3,500. So like Haley said, it is trickling in and folks are going to get that booster, which is great.
Yeah, that's not bad for it's only been available about a week, right?
Right.
So good job, Larimer residents, getting out to get your vaccine. So we do appreciate that. And then I think you covered everything on the flu shots. It's a little bit more familiar to folks. Is there anything else you guys want to add just about staying healthy or these seasonal vaccines?
Well, I think just reiterating the basics here, like you mentioned, Corey, washing hands, staying home when you're sick, getting vaccinated, and those really core activities that we can do to prevent any of these diseases, and is very effective.
Kind of on that note, Erica, so if someone does get COVID, are they going to get like an isolation letter or quarantine letter? What does that look like today? And what are the current guidelines in terms of staying home once you test positive and that type of thing?
That's a great question because it has changed a bit over the years. The current guidance is if you test positive for COVID or you suspect you have COVID, maybe you were exposed to someone with COVID and have symptoms, you should stay home for 5 full days from the date your symptoms start. Does not matter what date you tested, but the day your symptoms started, stay home 5 days. And then after that, you should wear a mask if you're out in public from days 6 to 10. And that's what's going to keep everybody safe and healthy. You would not receive a letter from us. Those are just the recommendations from the CDC, and there is no longer a recommendation for quarantine. So those who you're in close contact with, if you have COVID, there is no recommendation right now for them to stay home, but they should be monitoring for symptoms and test if they develop any.
Great, thank you. Is it the same with flu? Like, how long should someone stay home, or what's the incubation, or how does that work?
Yeah, so flu's a little bit shorter. The incubation period is usually between 1 to 4 days, and then someone can be contagious, they say somewhere around up to 5 to 7 days. So we do recommend you stay home at least 24 hours fever-free before you return to any kind of public setting with the flu. But it fortunately isn't transmitted for as long as COVID, which is why the isolation period there is a little bit shorter.
Great. Okay, well, I hope this information is helpful to our community out there. I appreciate you guys taking the time to fill everyone in on vaccines and just staying healthy. And again, for folks watching this, spread the word, encourage your loved ones and your friends and coworkers to get their seasonal vaccines for COVID and flu and RSV if they're eligible. Let us know if you have any questions. You can visit our website at www.larimer.gov/health. And you can also give us a call at 970-498-6700, and we'll get you to the right person if you have any questions. Thanks, you guys. Take care.